Marshall.
Thank you.
Senator Hassan.
Thank you, Senator Cassidy, and good morning still. We're in the morning, so, and welcome. Congratulations on your nomination, Doctor. I'm going to start out with a question I start all these hearings now with, which is, if directed by the President to take action that would break the law, would you follow the law or would you follow the President's directive?
Senator, I don't believe the President will ever ask me to break the law.
Well, that strains credulity, given especially the last few weeks, and it's a disappointing answer. I will expect you to follow the law regardless of whether the President directs you to break it. Now, let me go to the second question. President Trump has effectively frozen NIH funding for existing grants, including grants that directly treat people with rare diseases. My office has heard from Christine in Brentwood, New Hampshire, who is receiving treatment for colon cancer through an NIH-funded clinical trial, but now no longer knows the fate of her care because these freezes have delayed doctors who might be needing to hire new research assistants in the trial. This colon cancer trial may not have the research staff that they need to continue treating patients. If confirmed, will you commit to reversing the across-the-board funding freezes at NIH that have delayed life-saving clinical trials?
Senator, first, I absolutely commit to following the law, just in response to the previous question. But I also say on this question now, absolutely, I think that if I'm confirmed as director, I want to make sure that every single study that is advancing the health, our knowledge about health, including colon cancer, goes forward. Absolutely. Well,
the freeze is really delaying things, and it can have an impact, as you know, on treatment, and especially treatments for something like cancer, which can be very time sensitive. That's the harm that these illegal freezes by this administration have really put into play here. And I hope you will speak up loudly and clearly and push back at the President and Mr. Musk on these freezes. These were appropriated funds. Article 1 of the Constitution and the law says that the administration is supposed to be spending those funds in accordance with the grants and the clinical trial plans. President Trump has not only effectively frozen NIH funding for existing clinical trials, he's also stopped review of new grant applications to help develop new cures for diseases such as pediatric cancer. Your written testimony focuses heavily on questioning past NIH research, but you don't lay out a plan for supporting research by our talented scientists across the country to help treat devastating diseases. You've talked about this with some of my colleagues, but if confirmed, will you immediately restart all NIH academic review committees and get all appropriated money out the door?
If confirmed, absolutely, Senator. My job would be to make sure that those fundamental scientific meetings and other activities happen. The purpose of the NIH director is to support the mission of the NIH.
Okay, thank you. I'm going to forego the other questions I was going to ask and just say this. For people watching this hearing, for parents who are worried about autism in particular, let me just say a couple of things. We see more cases of autism in this country than we used to for a number of reasons, part of which is we're much better at diagnosing it earlier and understanding what the spectrum of it is. We have ongoing science that is beginning to point at the NIH, among other places, to genetic issues that may play a part in the development of autism and environmental issues. The now retracted study that suggested wrongly and fraudulently that autism might have a relationship to the MMR vaccine has been refuted by 7 studies, every continent, that involved hundreds of thousands of children. So for parents out there who may think that vaccines have something to do with autism, there is no scientific evidence that it does. And it disappoints me greatly that neither you nor the Secretary now of Health and Human Services are willing to say that declaratively and strongly, because what you do when you hesitate, what the Secretary does quite cynically in my view, when he hesitates about this, is you churn and sow doubt and worry at a time when we should be focused on actually finding the cure, the cause and the cure of autism. And similarly, when we talk about the causes of chronic disease in our kids, there is plenty of evidence, you've talked about it, working class folks, in America have worse health than richer people. And yet you are about to join an administration that is dedicated to giving more tax cuts to billionaires and taking away things from families, money and services from families that could help them live healthier, better lives and have children less subjected to things like hunger and housing insecurity, which contribute to chronic illness. So I hope you will think about that. I am over my time, and I think Senator Tuberville is next.